Good morning, folks. In my last little mini lecture, I talked about chapter 27, the male reproductive system. Today, I'm going to talk very briefly about chapter 28, the female reproductive system. Please first print out your study guide on page 1093 and the other important figures and tables that I suggested in a message that I sent to you. That makes it so much easier. Most of you are doing wonderfully well, and I don't know if this is part of your plan or not, but I just hope that I am helping somehow. Okay, section 28.1 is called Reproductive Anatomy. Going back very simply, we know that a man and a woman have different reproductive systems. They have different sex chromosomes, and when these two gametes, as they are called, the egg and the sperm get together, this forms a new human creature. First, take a look at figure 28.1 on page 1060. Also note figure 28.2 on page 1061. These show first the female reproductive system and then a cross-section of an ovary. The ovary is very important because it shows all of the different stages of the development of an ovulated oocyte, which is a fancy name for the egg, and starting from the primordial follicles. Okay. The female gonads are, of course, the ovaries. They have a cortex, which is surrounding them, fibrous tissue, connective tissue, and then the central medulla. In the central medulla is where the eggs mature from thousands of immature ovarian follicles. The ovaries are suspended inside the abdomen by a suspensory ligament, which also contains the ovarian artery and veins. They are not really in contact with the uterine tube, which we'll show you a little bit later in another figure. But when ovulation occurs and a mature egg is released, there is just a tiny distance from the surface of the ovary to the uterine or fallopian tubes. Okay, the uterine tubes are also called oviducts or fallopian tubes. They are shown quite nicely in part A of figure 28.3. You see that the tube empties into the body of the upper pole of the uterus, and then the tube itself has an isthmus, an ampulla, the infundibulum, and then the fimbriated ends that catch the mature egg and allow it then to move into the rest of the ovarian tube. The uterus is about the size of a person's fist when it is closed. It is a very thick muscular system that opens into the roof of the vagina, usually tips forward just a little bit and is in contact often with the urinary bladder. This, of course, causes some problems later if the lady is pregnant, and as your uterus grows, as the baby grows, it puts more pressure on your urinary bladder, and you know very well what happens then. Okay. The uterus has a fundus, which is the upper pole of the body. It opens into at the inferior end of the uterus is the cervix and the external os. This is where when a lady has menses, the blood escapes through the external os. The external os is also where the sperm can pass in order to flow upstream and come in contact with the ovary. The uterus is suspended quite nicely. You will see the suspensory ligaments in figure 28.3 that shows the female reproductive organs from a cadaver. In these ligaments are also uterine artery, uterine veins that supply the upper part of the uterus, as well as most of the lower part as well. Okay, the vagina is strictly a tube that is some 8 to 10 centimeters long that allows the discharge of menstrual fluid, and it is a canal through which the baby will be born. We'll see some more about that in chapter 29. I just want to mention the endometrium, back to the lining of the uterus. That is the innermost lining. That is shown quite nicely in figure 28.6 on page 1065. Under the influence of hormones, the endometrium becomes very much thicker and highly vascularized in order to accept a fertilized egg if that occurs. If the egg is not fertilized, then this thickness of the endometrium is sloughed off once every month or so, and that causes the menstrual flow. Figure 28.7 shows the blood supply to the entire female reproductive tract. That would probably be a good test question. Part of it comes from the aorta. Part of it comes from the internal iliac artery. Breasts are also included whenever one studies the female reproductive system. God gave women breasts in order to produce milk when they get pregnant. These breasts have two primary regions, the body, with the nipple at its apex, as well as an axillary tail that is an extension toward the armpit or the axilla. The body, the breast itself overlays the pectoralis major muscle. When a woman gets pregnant, then the mammary glands start developing milk, and they become much larger. Okay, I'm not going to talk about breast cancer on page 1068, but that is something that all of you ladies obviously should know about. Section 28.2 is called puberty and menopause. Puberty begins at age 8 to 10, according to your author, for most girls in the United States. It used to be age 12 or 13, but over the course of decades, this age has become younger and younger. Puberty is triggered by the same hypothalamic and pituitary hormones in girls as it is in boys. The beginning is stimulated by gonadotropin releasing hormone from the hypothalamus that stimulates the anterior portion of the pituitary gland to secrete follicle stimulating hormone FSH and luteinizing hormone LH. The ovaries then are the parts of the anatomy that will secrete estrogens and progesterone. Menarche is the age of the first female menses. According to research, this age has diminished by between 4 and 5 years over the last century. Mostly, according to the experts, according to improved nutrition. Climacteric, is when hormone secretion stops, and in women this is accompanied by menopause, and this is the total cessation of menstruation. Section 28.3 talks about oogenesis, which is egg production, as well as the sexual cycle that occurs in females. The sexual cycle encompasses all of the events that occur in the 28 to 30 days or so of a woman's menstrual cycle. It is very complex, and it involves at least 4 different hormones rising and lowering. We'll show you more about that in just a bit. Oogenesis, I want you to look at figure 28.11 and be able to go through that and know the different stages of the development of the egg first and then of the follicle. You remember that the egg is only has a haploid number of chromosomes, number 13, and the egg always has an X chromosome. Then when it is fertilized, then again you will have a zygote that has 26 chromosomes. The second part on the right-hand side of figure 28.11 shows the development of the follicle from, again, I mentioned the primordial follicles, until finally there is ovulation. Figure 28.12 shows some excellent photomicrographs of ovarian follicles in the different stages. I want you to go over these different follicles so that you could know what is happening very simply in each of the parts, each of the different phases. Now, the sexual cycle, female sexual cycle is shown in figure 28.14 on page 1075. It shows the different stages and relative peaks and valleys of FSH and LH on the top in the ovarian cycle. Notice that the surge of luteinizing hormone is what stimulates ovulation. That too would be an excellent test question. After ovulation, there is a small structure called the corpus luteum that remains on the surface of the ovary. It is responsible for the production of progesterone and the continuing production and release of estradiol. In the very bottom part of this figure, you will see the different phases and relative thickness of the endometrium through these 28 days or so of the sexual cycle. The cycle in stages is discussed very nicely in your text. 3 principal steps of the ovarian cycle, and then 4 primary steps of the menstrual cycle. Please go through those, yellow highlight, look at the definitions, and look at table 28.1 that shows you the different phases and the major features of the female reproductive cycle. Figure 28.16 shows again the endometrial changes that take place during the different phases of the cycle as well. Okay, I want to skip to section 28.5, talk about just the beginnings about pregnancy and childbirth. The definition of gestation is the average time of any creature that is produced from an egg and a sperm from fertilization until the time of birth. In a human, the average gestation is 266 days from conception to childbirth. But by convention, we usually start with 14 days before conception, which is the first day of the last menstrual cycle. When we add the 14 days, we come up with 280 days, which is 40 calendar weeks. This is the gestational period of a human. Looking at figure 28.18, you will see the different hormone levels that are necessary in order for the proper development of a fetus before the time of birth at 40 weeks. You will see HCG, human chorionic gonadotropin, that peaks in the first trimester, then estrogens and progesterone. If these are not present in the right quantities, then serious developmental problems can occur. Table 28.2 shows these hormones in a table, and it shows the effects of each one separately. That's an excellent source of information. I want you, especially the men in this group, to learn about what women go through while they are pregnant. This is on page 1082 through 1084. In figure 28.19, you get a very good photo, or not photo, but a sketch of what can happen to the female body when she has this little parasite called a baby inside of her now huge uterus. Imagine what this is doing to the intestines, to the urinary bladder, to the diaphragm, etc., etc., etc. There are many changes that must take place during the gestational period. Read about them, as I mentioned, pages 1082 through 1083, and then there's a short discussion about childbirth, the different stages of labor. There are 3 primary different stages of labor. First being the dilatation phase, when the cervix must dilate in order for the baby to be expelled. Commonly, this is about 10 centimeters. The expulsion stage is the second stage, and this is when the baby is actually pushed out of the uterus and further down into the vagina and into the birth canal until you can just see the top of the baby's head in a normal presentation, the vertex position. That when the baby's head is seen, that is called crowning. Very shortly thereafter, the baby is born. And then finally, after the cord is clamped and cut, the cord that between the baby's umbilicus to the placenta, then the placenta is expulsed, and this is the third stage of labor, or third stage of the childbirth. And there are some excellent photos and sketches on there it is, figure 28.20 on page 1086. Just a couple of words about breast milk lactation. First is defined as the synthesis and ejection of milk from the female mammary glands. Colostrum is the very first thing, first substance that is released. This colostrum is extremely important to a baby. It contains numerous immunoglobulins that protect the baby from infection. It also is extremely high in nutritional value. If the mom does decide, as I always tried to get my mothers to do, if she decides to continue with breastfeeding, then the hormone prolactin comes into effect, and this continues, enabling her to produce enough milk to feed a baby actually all by itself for 6 months, and even further than that in some instances. Table 28.4 shows the comparison in different nutrients of colostrum, human milk, and cow's milk. Please remember that cow's milk is a very, very poor and sometimes dangerous product to use for a newborn baby. It can actually cause problems in the baby's gut, and I have seen severe anemia develop. Human breast milk is by far the best nutrition for the baby. Formula is quite expensive, but is an adequate substitute for human breast milk. Okay, that is all for chapter 28. Thank you very much.